yang esophagus. As a result, ang imong gi-intake nga food and liquids dili siya makapass through easily down into our stomach. It occurs equally in men and women. Narira. Then the causes is first idiopathic, secondary to Chagas disease, and autoimmune damage to the nerve cells and pseudo-achalasia. Signs and symptoms is slowly progressive dysphagia. So, naay ka na ganing maglisod ka og tulon, pero sometimes makatulon ka, mo siya slowly progressive. Then, regurgitation, chest pain, moderate weight loss. Treatment is to reduce the pressure and obstruction of the cardiac sphincter, esophageal dilatation, medication which will nitrate and calcium, chemical denervation, and surgical myotomy. Next. Imaging. First decade. Katong achalasia, it occurs between ages of 20 and 40 years. So, dinha ara kasagaran mo occur katong achalasia. Imaging modality, this picture, in the picture A, dito sa ibabaw, is an erect esophageal image demonstrating achalasia at the level of gastroesophageal junction. The distal esophagus terminates into the beak-like appearance. So, makita mo din na siya kanang murag gainana. So, man siya beak-like appearance. Then, in picture B, the image of achalasia at gastroesophageal junction. Next. So, let's move on to the diverticular disease. So, diverticulum is a pouch or sac of variable size that occurs normally through a defect in its muscular coat. Mura siya og small balloon sa nga diri sa kuan ato ha diverticula. Mo ni siya diverticula kanang murag nga burot-burot. Then it happens when the inner lining of the organ pushes through a weak area in the muscular layer or the muscular coat. Next is the esophageal diverticula. It occurs when mucosal outpouchings penetrate through the muscular layer of the esophagus. This little pocket in the esophagus kay mo siya where food or liquid is dito siya sometimes get trapped ba more siya bulsa dito sa ato esophagus where ang ato ang food nga liquid ug intake is sometimes masulod siya dito so dili siya malahos sa ato nga stomach. Then, two primary types of esophageal diverticula. First is the pulsion diverticulum, which involves only the mucosa and results from the motility disorder of the esophagus that allows the mucosa to herniate outward. So, siya agini siya nga, ang pulsion diverticulum kay it appears in the radiograph as a round, like rounded projection with a narrow neck, and of course more frequently in the upper and lower part of the esophagus. Now, siya three types, which is first is the Zinker diverticulum, which is a pulsion type found at the pharyngoesophageal junction at the upper and in the end of the esophagus and the posterior aspect just above the cricopharyngeal muscle. Second is the Killian-Jamison diverticulum. It originates in the lateral aspect of the esophagus. So, makita nimo siya sa lateral part of the esophagus. Then, the last one is the epiphrenic diverticulum, which is found in the distal esophagus just above the hemidiaphragm. So, siya sa merg end na, doon na siya sa tuhang. Next. Second type of diverticulum is the traction diverticulum. It involves all layers of the esophagus and results from the adjacent scar tissue that pulls the esophagus toward the area of involvement. So, kung ang pulsion diverticulum is, ang magkuha niya is ang upper part o lower part sa esophagus, ang traction diverticulum is all layers na dyan siya sa esophagus. Next, causes niya is increased pressure inside the esophagus. So, kung ma-pressure ang esophagus, diverticulum. Basta. Then, excessive esophageal muscle contractions. Then, fibrosis, congenital weakness. Signs and symptoms, dysphagia, regurgitation, halitosis, cough, chest pain, weight loss. Treatments niya includes the diet modification, the peroral endoscopic myotomy or POM, diverticulolectomy, and diverticulotomy. So, we are now in the last part of our discussion, in my discussion. Colonic diverticula is a small pouch-like sacs that form in the wall of the colon. Most often, dyan na siya nasa sigmoid colon. First type is the diverticulosis, which is the presence of diverticula without inflammation, frequently in sigmoid colon, among adults over 40 years old. So, kani siyang gagmay-gagmay, na siya burot-burot, pero wala pa siya ni, dili pa siya inflammation. Then, next is the diverticulitis. Muna ni siya ang from the word litis, which means ni inflammation na siya, so swelling na siya, or infection. It occurs approximately 10% to 20% of patients with known diverticulosis. So if ang patient is nana siya oy diverticulosis, which means nana siya nagsugod og burot-burot, na siya dako nga chance nga mo-infect to siya, which is magka-diverticulitis na. Causes niya is low fiber diet, aging, lack of exercise, obesity, family history. Signs and symptoms: lower left quadrant pain, pain and tenderness, fever, increased white blood count, occasional rectal bleeding, which is kung mag-occasional rectal bleeding na siya, which is makakuha na siya ng alarmic pod. Then treatments is reduction of inflammation and infection, antibiotic therapy, via sonography, and surgical resection of the bowel. So I hope you all understand what I am explaining here in front. Ay, napaday image mo natin. So, first picture is a large Zinger diverticulum in the esophagus of a 67-year-old man with complaints of difficulty swallowing over the past 6 months. Then, the second picture is Zinger diverticulum in the same patient but on a magnified view. So, kung tanawin mo, kung anong di-magnified na siya, so mas dapat na dyan siya natawag. Then, the next picture is an epiphrenic diverticulum shown as a large collection of barium connected and adjacent to the lower esophagus. Third picture is the traction diverticulum indicated by the outpouching of the esophagus at the level of the carina, seen in an esophagogram of a 47-year-old woman with a history of ulcer disease. Then, on this part of our PPT, nasya ito a picture. Picture A contains an air-conscious barium enema demonstrating diverticulosis in various projections. Then, the right lateral decubitus projection, which is in the picture B, and the posterior anterior axial sigmoid projection and digital spot image. So, and the last picture shows the computed tomography scan of abdomen demonstrating the information of diverticula or diverticulitis.
Okay, so let's move on to the next and last disease, which is neoplastic disease. So neoplastic disease can occur anywhere from esophagus to the colon and can affect digestion, nutrient absorption, and overall health. So GI system helps to digest and absorb some nutrients. So, however, it can develop growth called neoplasm or tumors, and nasa yung ang buok, which is ang benign o ang malignant. And benign is kanang non-cancerous or slow growing, and sa malignant, cancerous or fast growing, and dali siyang makaspread sa other organ. So, tumor of the esophagus, so abnormal growth in lining of the esophagus. So, nasa types, which is ang benign o under niya is leiomyoma and sa malignant is esophageal carcinoma. And ang symptoms ani is difficulty in swallowing, chest pain or discomfort, vomiting or kanang mas worse kay vomiting blood na good or weight loss. And so, muna siya mga diagnostic methods with kanang barium swallow, endoscopy, and CT scan. So, if ang person kanang na siya long-term nga acid reflux, so ang iyang esophagus or acid niya kay mo sige burn sa esophagus, and kung magsige ni siya, this constant irritation can cause normal